I'm Dr. Charles Klodell. I'm a thoracic and cardiovascular surgeon, which means that I'm board certified in both general surgery and thoracic and cardiovascular subspecialty care. I've been in practice now for over 20 years. I perform annually about 350 operations, ranging from diseases of the chest to any diseases of the heart or aorta. One of the things that not many physicians understand and patients suffer with is hyperhidrosis. It affects about 1% of the general population and refers to somebody that has excess sweating, most commonly in their palms or their feet, or sometimes their armpits. As silly as that might sound to somebody who doesn't have it, for people who do have it, it causes tremendous suffering, social anxiety, and can particularly be difficult in children during school-age years. There's solutions available for it. Many people try some of the medical therapies that are, in some cases, successful, but in about half of the patients that have it, the medical therapies just don't control it at all. For those patients, we offer a procedure called endoscopic thoracic sympathectomy, commonly referred to as ETS. Endoscopic thoracic sympathectomy is a small incision surgery that's done right under the base of the armpit, where we look inside the chest and look behind the lung and work on some nerves that go down the back of the chest called the sympathetic chain. That surgery is a general anesthetic. It takes about 45 minutes to perform. We do it with 3mm instruments, which are about the size of a ballpoint pen refill. The patients go home the same day, and in greater than 90% of cases, it completely resolves their symptoms and allows them to return to a normal and uninhibited life. For patients that have that condition, people that don't have it don't understand what they're going through. And this offers a solution for them to live normally.